I am Landry and I am 20 years old. I was struggling a lot with depression and anxiety, and it started when I was really little, around 2 years old with the anxiety, and it started to manifest a little bit when I was about 14. And so it became a really big issue through high school, and at 17 years old, I realized I really do need some form of help. I talked to my therapist, and she actually recommended HopeWay. And when I found out about it, I looked it up and instantly was met with true hope. I realized I was not old enough for treatment. I was really nervous and sad to know that there wasn't many things out there that could help me at 17 years old. Waiting out until I was 18 was rough. It was about a little over 2 months, I'd say, of waiting. And I definitely used to think, like, what if I can't wait these 2 months? What if I can't wait until I'm an adult for treatment? Then what happens?
I am so excited that we are expanding our service offerings down to our adolescents and young adults. So HopeWay at Oakhurst Commons is going to be our new campus for young adults and teens. We have 2 different programs. One is for mental health issues, including depression, anxiety, bipolar disorder, and then the other program will be for those struggling with eating disorders. Our youth and young adults who are struggling with anorexia as well as binge eating disorder and other disordered eating patterns is really on the rise. Eating disorders also have one of the highest lifetime mortality rates, and so it is crucial that we get kids access to care that is quality and evidence-based. So the HopeWay model is really looking at the whole person, so looking at the medical issues, the psychiatric issues, and the substance use issues, and then looking at a very well-rounded treatment plan, which could include seeing the psychiatrist, seeing an individual therapist, but having group therapy, and then a whole host of modalities that can increase wellness, including nutritional support, exercise, yoga, music therapy, and now to bring this to our children is just, it just is amazing.
William was a senior in high school and was increasingly seemed disengaged.
He was kind of in an increasingly bad place for a year that led up to coming to our room in the middle of the night saying, I really need help. I'm thinking about taking my life.
Probably the scariest night of my life because you don't know what to do. You know, like, I want to kill myself, help me, and he's crying in my lap like a 2-year-old, like, please help me.
I don't know what the hell to do, right? So I called HopeWay. But we were fortunate that he was 18 and able to go there even though he was still in high school.
And if he wasn't 18, I don't know where we would have sent him.
They were great about keeping us kind of incorporated in what was going on and the plan for care, both while he was there and moving forward. Just making us feel like we were part of the solution and really giving us the tools to kind of reintegrate him back into the house after being gone for a month.
There is an incredible amount of need for mental health treatment, and so it's really hard to see people struggle and not know of anything to do for it and not know that there's actual hope into getting better. I think that if I had gotten HopeWay's quality of care at 14 years old, I would be a lot further in my recovery, and so it's really good to hear that kids around that age are going to be able to get a chance at recovering earlier.